Okay, Dry Mouth Doctor here. We're going to be talking about this case that we talked a little bit about briefly in an introduction to the case study, which happens to be about the angulation of the front teeth. I'm going to show you the position of the implants that I decided on. That's not what I want. Cancel. Let's go to implant and show you. Let's see, right there. So this is the case where we're looking at 4 implants to solve the case on the upper, and we have 6 implants planned on the bottom. Like I said, I don't like the angulation problem here, and it becomes more difficult to do a proper prosthetic restoration if we had implants towards the real front right here. So we try to keep the implants away from that for a lot of reasons, but this is a good position. And one thing I do want to note here, and it'll be hopefully clear, we're always trying to create a balance. And when you think about a prosthetic, a denture prosthetic, think of it as one tooth. The whole prosthetic, the whole arch is all together. There's no longer singular teeth that can move themselves. They all now work together. So think of it as one tooth. That one tooth is an arc, and that arc needs to be balanced just like a stool. And right here, we have a stool with 4 legs. That's what we want. We can do sometimes 3 legs, but this is not that case. And we want to do 1, 2, 3, 4, and we want them to be fairly well spread. So this one could probably even be more spread over here to give that a little bit more balance. And here's the front teeth. So that's why the upper shows us this. Now, people ask me, well, do you recommend having 2 more implants? So maybe right here, and then another one maybe right here. We lost it right here. And yes, I say that that's a 6 implant prosthetic case. And in this situation, you're going to have a difficulty right here with this bone defect. It's going to take a long time to heal that if you want to try to get it down the middle, because it's very hard to get an implant right on that edge right there, regardless of having bone. But you definitely want to think about, am I over-engineering the job? What benefits would the patient get if you added 2 more implants, etc., etc.? So I think as far as a prosthetic's concerned and chewing and everything's hunky-dory, 4 implants are enough. You don't have to spend more money on 6 implants, given that you have to have good oral hygiene. So this patient has decent oral hygiene, actually. It's mostly medication driven. So let's go back to here. This is the way he came in. He has some redness here, but he has that recession, and he's got a little bit of buildup here, but he can a little bit stain, but that looks pretty good. Overall, not too bad. And so he's not in the worst shape ever, but he is also not technically in the best shape, obviously, because he's losing all his teeth. So what is it that he might be losing his teeth to? Well, not sure, and this is where it does happen that we don't have all the answers, but there is something that's causing him to lose his teeth, and that can be concern of how he might lose a dental implant. Just like you have periodontitis, you can have peri-implantitis. And I only really recommend that we would put 2 more, in this case on the upper, for maybe added retention if you have a snap denture, like a locator attachment denture, which is what I always recommend because they're more easily cleanable. You can clean those just a gazillion times easier than a fixed piece. And here just adds more retention. If you do a hybrid case where that is like the clear choice or hybrid fixed denture piece, I might consider it as doing 6 as well. And that's mainly because they're more susceptible to getting infections and having peri-implantitis. And if you lose 1 implant on these 4 locations, you now have a car with 3 tires, and we know how well those drive. So it doesn't work well. It's all on 4, but none on 3 is what I call it. So you don't want 3 implants to hold a whole arch. And so if you're doing a hybrid denture case, I would recommend doing 2 extra implants, because in 5 to 10 years, if you lose one of those implants, which is a possibility due to infection because it's fixed and it traps more food, you then have now a situation where if you lose one implant, okay, you lost one, you can still run the denture prosthetic on 5. So that's pretty much the only reason why I would recommend, in this case on the upper, that we would do 6 implants. So stay tuned. We're going to talk about the lower in another video.